Hello, this is Christopher South, your friendly neighborhood paramedic, and today we're going to be continuing on looking at the endocrine system and talking about hormones and how they affect different parts of your body. And today we're going to be talking about how some of the hormones that we can inject into a patient during emergent situations and how they work. And we're going to be looking very specifically at drugs that affect the fight or flight response. Now, if you remember, what you've learned so far is that organs produce certain hormones, and those hormones travel through the bloodstream and they act on target cells. And in those target cells are things called receptors, and receptors are basically little doors that open up and allow that hormone to go in there and to turn on those receptors and make different parts of your body do certain things in order to maintain homeostasis. That's what we're trying to do. We're trying to keep the body in a nice balance. But unfortunately, when your body can no longer regulate itself, when it can no longer compensate, these patients end up in my emergency department. And so I want to talk to you about a couple of different types of patients that we may have to inject and stimulate that hormone pathway to get some things happening. The first one I want to talk about is anaphylaxis. Now, I don't know if you guys remember much about anaphylaxis from some of the earlier studies that you may have done, but if you're going to go into a healthcare career, really important to understand what anaphylaxis is. So anaphylaxis is a really bad allergic reaction. And what can happen is one of the major things that can go wrong is the patient can develop bronchial constriction, is where it's really difficult for them to breathe. They may have wheezing and things. They may develop something called hives. And one of the other things is they get hypotension. And they get hypotension is because during anaphylaxis, it causes vasodilation. It means the blood vessels go, and when that opens up, the pressure goes down. So one of the cool things is we can give them a medication called epinephrine 1 to 1,000, also known as adrenaline. And you're probably familiar with adrenaline because it comes from the adrenal glands, goes in there, and what it does is it works on those alpha receptors, and it causes vasoconstriction, which makes the blood pressure goes up. It causes bronchial dilation, so the patient has an easier time breathing, and basically it stops the anaphylaxis from happening. And one of the cool things that medication does is it also acts on receptors that are responsible for histamine production. And so when we stop those histamines, the body quits reacting like it is, and the patient gets better. We typically kind of follow it up with Benadryl, which kind of helps with the symptoms. So that's how we use epinephrine 1 to 1,000. So I want you to remember that concentration, all right, also known as adrenaline. So that's for anaphylaxis. So we do have patients that come in and can be in different types of shock states. And so what shock is, the definition of shock is inadequate perfusion. All right, so we have inadequate perfusion can be caused by a number of things. All right, and so when a patient comes in, one of the first things that we try to do is try to figure out what is the cause of that shock state. Is it a pump problem, like if they're in cardiogenic shock, so their heart isn't pumping effectively? Is it a container problem where the blood vessels are dilated, and so when that blood vessels are dilated, we're not going to have as much volume and we're going to lose that pressure? Or is it basically we have a volume problem? We have volume depletion, is where the patient is bleeding out. Maybe they've been vomiting a lot, having diarrhea, and we just don't have enough volume. And not having enough volume is a pretty easy fix for us. We can usually treat that with IV fluids and sometimes blood. If we look at their lab values and we see that they don't have enough blood, we can, of course, fix that. But if that doesn't work, let's say the pump problem is a little more complicated to fix, but let's say we have a container problem. The container is really big, and if we put a bunch of volume in there, it's not going to fix anything. So what we need to do is to shrink the container. And we've got a bunch of different drugs that work fantastic for that. And these drug class is called a pressor. All right, so if you think pressure. And so a lot of the pressors that we use are also, they act on those hormones and go to those target cells and everything, just like epinephrine 1 to 1,000. So if we have patients that are hypotensive, or we have patients that are in, let's say they're septic and they're in septic shock and we have a container problem, one of the things that we can do if we're giving them volume, if we're giving them IV fluids is ineffective, we can give them a medication called norepinephrine. Now, norepinephrine also is produced in the adrenal glands, and it works just like epinephrine, and it does the same thing on the alpha. Tightens everything out, also causes that bronchial dilation. And this is going to be great for these patients is because we're trying to raise their blood pressure up and get them to a place of homeostasis. It's because what happens is if we have low blood pressure that's below a certain percentage of what's known as mean arterial pressure, if we don't have that above a certain level, that means the organs can't perfuse. It's because it's not tight enough to get that blood flow where it needs to. And so that's what we need to do, and that's what pressors are for. Now we have norepinephrine. We have another pressor that we can use, which is just plain old epinephrine, and we can give what's known as a push dose pressor of epinephrine, and it works the same way. Other medications that we can give include neosynephrine and dopamine. All of those kind of work the same way, is getting that pipe to shrink, and so that pressure can go up, and we can get better perfusion to all of those important organs, especially the heart and brain. So the last thing I want to talk about today is a medication that's really, really important, and one that we do use, in emergent situations. So let's take an example. We have a patient that comes into the emergency department. All right, comes in, they're clutching their chest, and they're saying, "Hey, I don't feel good. I've been really nauseated. I broke out in a cold sweat, and I feel like I'm going to pass out." We get them up on the gurney. We start getting ready to draw labs, start our IVs, get everything going, and all of a sudden the patient goes, and they're out. We look up on the monitor, and the patient is now in cardiac arrest. So what cardiac arrest means is the heart is no longer pumping, the patient's no longer breathing, the patient is effectively deceased. And what we're going to have to do is act quickly to do our best to try to restore that body back into homeostasis. And we're going to have to do that through external means. So one of the first things that we do is once we start pumping on the chest, so if the heart isn't working effectively, we start doing cardiopulmonary resuscitation. So we're the blood that's in there, all right, is we're circulating it around and getting it around to all the organs and everything. But what we need is what we want to do is to get that pressure up so we're really pushing that blood flow where it needs to go. And the medication of choice for that is epinephrine 1 to 10,000. It's a different concentration. 1 to 10,000 epinephrine is used in cardiac arrest is because it also works on those alpha receptors. It shrinks everything down. But one of the other things that it does is it causes better contractility in the heart, causes more blood flow to squirt out from the heart and getting it onto the brain and everything, and also causes a rate to go up if we can get the heart started. And so we give that, and our hopes is to get that patient into a shockable rhythm. And that's where we can restore the heart, hopefully back to a regular rhythm and get everything going. And so that is how those drugs work. And so you think about it, those hormones that we learned about the last 2 weeks are very important in medicine. We talked about the diabetic side. Now we're talking about pressors and how we're trying to stimulate that fight or flight response in order to save lives. So think about pressors, think about pressure. And so what's awesome is so that normal fight or flight response, which gets you to breathe faster so you can run away, gets that heart pumping faster and more effectively, shrinks the your blood vessels down so blood gets there quicker and faster and gets your blood pressure up. It helps you to escape things that your body thinks they need to escape from. But when the body is unable to maintain homeostasis, sometimes us as healthcare providers have to insert those artificial hormones into the patient in order to elicit that response that we're looking for. So I hope you enjoyed today and learned a little bit about how pressors work. We learned about 3 of them, and remember, epinephrine 1 to 10,000. 1 to 10,000 is known as cardiac epi, and that's what we use typically for cardiac arrest and cardiac issues. We have norepinephrine, all right, which is a pressor that we give a lot of times for hypotensive. All right, and remember, in anaphylaxis, our drug of choice is epi 1 to 1,000. A 1-to-1 concentration works fantastic. Thanks so much for watching. And what I got something really cool for you guys next week is because we're going to be talking about blood. I'm going to record from right there at the hospital. I want to show you all the things that we do with blood. We're going to talk about the things that we look for when we're drawing blood, some of the different lab values we're looking at, and the importance of why you need to donate blood. So thanks so much for watching. This is Christopher Salve, your friendly neighborhood paramedic. Thanks again. Hey, and subscribe if you want to. I'm not making any money off of it, but it is cool to see some numbers on there. Thanks again. Bye-bye.